Over sexual indulgence bad effects. मेडिसिन एवेना सटाइवा। होम्योपैथी अपनाएं, बीमारियों से छुटकारा पाएं। मित्रों नमस्कार, आपका मेरे चैनल पर हार्दिक स्वागत है। इस चैनल को सब्सक्राइब करते हुए बेल आइकन को प्रेस करके ऑल के ऊपर ज़रूर क्लिक करें ताकि आपको आने वाले सभी वीडियोज़ का नोटिफिकेशन मिल सके। The purpose of knowledge shared here is only educational and to increase awareness. Please always consult your doctor before taking any medicine. Self-treatment may always be injurious. Friends, today we shall know when to use medicine Avena sativa in bad effects of over sexual indulgence. Dose is suggested at the end. दवा की मात्रा और पोटेंसी अंत में बताई गई है। आइए जानें बैड इफ़ेक्ट्स ऑफ ओवर सेक्सुअल इंडल्जेंस में दवा एवेना सटाइवा कब उपयोगी है। मेडिसिन एवेना सटाइवा इज prepared from oats. The fresh green plant gathered in August is pounded to a pulp and macerated with 2 parts by weight of alcohol. Avena sativa is preeminently antineurotic, quieting the nervous system to a remarkable degree. Its special sphere of action seems to be upon the male sexual organs, regulating the functional irregularities of these parts. It is a most useful remedy in all cases of nervous exhaustion, general debility, nervous palpitation of the heart, insomnia, inability to keep the mind fixed upon any one subject, etc. More especially when any or all of these troubles is apparently due to nocturnal emissions, masturbation, over sexual intercourse, and the like. It is one of the most valuable means for overcoming the bad effects of the morphine habit. In most cases in which the habitué has not used more than 4 grains daily, the opiate may be abruptly discontinued and even substituted without any serious results. If a larger quantity than this amount has been taken for some time, it is better to gradually reduce the daily dose of morphine in the usual manner, simply prescribing the Avena in addition. The latter should be given in the same dose regardless of the amount of morphine taken. In other words, it is not necessary to increase the Avena as the opiate is withdrawn. When the quantity of morphine has not exceeded 4 grains daily, it should be stopped at once and Avena given in its stead in 15-drop doses 4 times a day in a wine glassful of hot water. By this method, the disagreeable after effects will be much less than though the dose of morphine is gradually reduced, and the patient will find life quite bearable as a rule at the end of a week. Avena sativa should always be given in appreciable doses of the tincture, 15 drops 3 or 4 times a day, well diluted, will usually meet the case. It may be given in doses of from 5 to 60 drops in rare instances. It should, however, never be given in larger quantities than 20 minims unless the patient is thoroughly accustomed to the remedy and has found the usual dose insufficient. Otherwise, there is danger of getting the physiological effect of the drug, which is pain at the base of the brain. When this symptom makes its appearance, the medicine should be discontinued for a day or two and then given in reduced doses. There seems to be no danger whatever of forming the habit of taking this drug, as it can be suddenly abandoned at any time without evil consequences, even when given in large quantities. Whenever a quick action is desired, and in all cases where avena is given to overcome the morphine habit, it should be prepared in hot water. It is also a good plan to prescribe it in this fashion where indigestion complicates the case. Dose: medicine avena sativa mother tincture, 1 to 15 drops in 10 ml water 4 times a day, or as advised by your doctor. Wishing you a happy and healthy life. Thank you.